Hey, Erica. Well, always so great to chat with you. I think last time we were together, it was wine tasting, so slightly a different setting here, but great to see you again.
Great to see you. Thanks for having me, Erin.
Of course. Diving right in, heard a statistic from McKinsey estimating a 10 to 20% workforce shortage in nursing. You're chief nursing officer, have been in the space a long time. What are you seeing? Why do you think that shortage is coming?
The shortage has actually been coming for quite some time. We've known as the boomers and our population ages that meant that our workforce was going to age as well. I think the birth rate changing is also contributing to a decrease in just people in the workforce as well. So I think one of the extenuating circumstances that happened was that wonderful thing called the pandemic, the COVID pandemic, that actually accelerated some of that. And so McKinsey's certainly right. There is going to be a shortage. I think what I'm most concerned about, though, Erin, is that in the rural setting, it's even going to be more pronounced because of our setting, because of the fact that our winters aren't that magnificent. It makes it harder for us to keep people here. Now, what are we doing about it? We have to figure out ways to do our work differently. Not that we always haven't had to do that, but I think because of the changes in our workforce, we have to do our work differently. So certainly the shortage is top of mind for me. We spend a ton of time on what does our pipeline look like? How do we recruit the best and the brightest? And then how, most importantly, do we retain the most amazing talent that we need to have, not only in our hospital setting, but in our clinics, in our community setting, as well as in our skilled facilities at Sanford and Good Sam.
Yeah, I feel like you're always so. One of the things I really appreciate about you as a leader is how much you understand what's happening on the front lines, how creative you are, how passionate you are, and sort of very willing to try new things and innovate in how people experience their work. So as you think about the nursing shortage, nursing burnout through the pandemic, and you sort of started to describe the jobs that nurses will have, and how are you thinking about changing what nursing looks like 10 years from now, 5 years from now?
Well, there's a need to actually even look in 2024. What are we going to do different? So to your point, I spent a ton of time at the bedside, and so I think that that's one of the things that I hold most dear is the fact that I love taking care of patients. And I think all of us are going to be patients ourselves or have cared for someone or have a family member that's been a patient. So how do I put myself in their shoes and how do I make sure that we're setting everyone up for success? There's magnificent technology out there. And I think, given the high touch profession of nursing and medicine, we have to look at different ways to do our work so that our people can get back to that amazing practice of that hands on care. That means getting rid of the stupid stuff. I always talk about growth, but that also means by taking care of and getting rid of some of the non-value add work, that means that we allow people to make those true connections with their patients in their most vulnerable times in the hospital setting. I appreciate you noticing my passion and really the voice of our frontline team. That's something that's been incredibly valuable to me to make sure that we're solving the problems in the right way. I think you've probably heard me talk about this, as have many, as I love technology. As long as it's helping us meet the mark, as long as it's helping us actually solve a problem, that's a problem that needs to be solved, and technology can do that for us. Technology is amazing. The tools that we have at our fingertips are really quite incredible, but it takes changes in process, and it also takes making sure that our people understand the why behind the change and really the rationale, and then holding ourselves accountable to we can't do it the traditional way. We need to try to do it this way, and this is the big, huge why. It's going to save us time. It's going to be more reliable. It's going to be safer for our patients. And I think us leaning in to try things has been something that's been really exciting and really fun. We've got a ton of nurses in our organization that are brilliant. I always say that the brilliance at our bedside, and why wouldn't we lean in, get their feedback, get their insights about what works and what doesn't work, and then actually challenge them to say, how about we try it? Let's fail forward fast. I'm never, ever going to put anyone at risk. That's never the intent. But us not trying is probably putting us at more risk as a workforce as much as anything.
I love the connection to the why in thinking about how the job might look different, next year than it did last year, to help navigate the change management element. What are one or two examples that come to mind about something you can take to your nurses and say, this is connected to why you love being a nurse, and we can actually unlock your being able to do this that you weren't able to do before because you were doing the stupid stuff. So when you get rid of some of the stupid stuff, what are a couple examples of things you can unlock to make nurses' lives better?
I love that question, and I'll try to keep it to two because this has been like my pursuit over the last several years, and really my entire like second half of my career is okay. What's the big problems that we need to solve, and how are we going to get that done well? How do we engage the frontline teams and then execute in a way that is easy for them to be held accountable to? So, first example that comes to mind is how are we using that wisdom of our aging workforce? So, back to your question about our shortage that's coming, how do we leverage the incredible wisdom that we have within our organization today? So we actually have been piloting a program for virtual nursing. And how do we use technology to help us leverage that wisdom and help bring some of that joy back to the work for those frontline teams? So using computer vision technology, as well as that virtual nurse component. Again, got to have the brilliance in all spaces in healthcare to help us do this, but how do we aid in taking some of the load off of that frontline team so they can get back to the work that they need to? So that our virtual nursing program is really been exciting for us to hold near and dear. But again, I'm also very passionate about making sure that we look at all realms of our business, and so I'm really excited about the work that we've been able to do leveraging Notable, and actually not just the digital registration. That's where we started. That was our biggest problem that we needed to solve. But I'm like, why wouldn't we? Why couldn't we engage our patients in some of that clinical intake as well? And I'm so excited to share the amount of effort that we've actually relieved in deploying our PHQ-2 and GAD scoring has been amazing. And again, it was leveraging a couple questions, the text functionality within Notable, but then more importantly, it wasn't just about the patient experience. Let's take it through the entire life cycle of that communication. So from the text message all the way to how does it interface with Epic, and how do we make that workflow so seamless that there was not a hiccup that ended up happening because we were using the tools that we already had. But it took us time, it took us effort to do that. But we were able to prove we were able to go live in well over 200 departments in one day with
Hmm.
not one ticket that came through, which was amazing to me.
That is
So
amazing.
yes, it's excellent. Our engagement, we've got over 99% engagement once they start the Notable experience and completing that. And I think you also know how big depression and behavioral health is as a problem in the United States. So this
Hmm.
was a really exciting way for us to address not only the workflow challenges and ease some of that burden on our frontline teams, but also don't stop asking the questions because there's not time. Continue to lean in and ask and engage with our patients and get them connected to the right resources, more importantly.
Have you thought yet about where that freed up time is gonna go to?
What's really fun to talk to our frontline teams about is what else can we actually engage our patients in that way? So, what about postpartum depression? What about our asthma screening? What about some of these kinds of things? And then, more importantly, how do we think about doing this in the emergency department, in our urgent cares, in our acute care, so that we can give people time back to make that connection? I think all of us know how important it is to spend a little bit of time, sit down for just those 2 minutes, make that connection with the patient so that they can gain trust in the situation, knowing how vulnerable those situations are, even if it's in that clinic in a standard visit. How do we make that connection? I think, as you all know, I've referenced us being the largest rural healthcare system in the United States. Our communities are extremely important to us, and the people that we take care of in our critical access hospitals and even our urban settings, they're part of our families. They're part of a lot of connectedness that we have in our communities.
I think we all have a sense of just how big Sanford is. Can you give some order of magnitude? How many practicing providers, how many nurses, how many ambulatory visits per year is Sanford doing?
Yeah, so we stretch about 250,000 square miles in our acute care business. So we've got
Incredible.
almost 300 clinics. We've got about 45 medical centers, 4 major medical centers, several critical access hospitals, as well as some PPS hospitals. Again, care close to home is incredibly important to us. We've got 2,700 providers, as well as about 8,600 nurses that serve in a multitude of different ways. I'd be remiss if I didn't share that we also have a health plan that helps to serve members across our footprint and beyond, as well as a skilled facility through our Good Sam partner. So we have the privilege to take care of people from birth to death, which is an incredible opportunity that we have to connect with these individuals, but also a big burden and something that we need to be planning for and making sure that we have the workforce doing the right things at the right time.
Hearing you talk about the challenges of shortages coming, workforce burdens, the aging of the population, obviously one of the important technologies is going to be AI to help augment what teams do, to help offload some of your nursing responsibilities. Where are you seeing AI starting to play in today? Where are you looking to AI? How is your organization thinking about bringing AI to the front
I
lines?
am so excited to chat about how we're actually using AI. I think in many cases, it's certainly become a very important buzzword for everyone to be paying attention to. But from my perspective, we've had AI and other predictive analytics that we've been using for a long time. We just didn't maybe call it AI, or we
Yeah.
didn't call it truly what it was. Um, in our journey, I'd say that we're fairly mature. We have an incredible enterprise data and analytics team. We've got data scientists as well as a host of different analysts that actually have been helping us navigate data for a long time. It's just been within the last couple years that we've really been investigating how do we continue to build predictive modeling to help our teams actually function smarter. Not just our providers, but we also have how do we use the data that we already have within our electronic medical record to help us identify efficiencies, identify some of those triggers to help us actually do our work differently. Additionally, I'd say the other opportunity that we have is how do we actually identify some of our patients using AI and other data sources, understand where those inequitable spaces are. So, health equity is another thing I'm extremely passionate about. How do we use technology to help us gain access to those people that maybe don't have access based on their zip code, based on that rural setting, based on potentially the technology that they don't have. So I have the privilege to sit on several governance committees, one of which was just talking about a 34-page document that really talks about this is the definition. This is how our governance is set up. This is the risk.
Hmm.
This is our tolerance. So, really trying to set the stage and put some form and structure around the incredible work that we're already doing.
Is that a new governance body or something that you already had and you're augmenting?
Good question. We've already had the governance committee. It's been data governance. It's actually started way back when we put our clinical database together. That was when the governance committee started. I remember starting it and how interesting and simple the conversations were now. So to see the maturation of this group, it's basically just a culmination of all that experience over time, as well as really trying to meet the compliance and some of those risk components. Sanford has the privilege of being at the table in Washington, D.C. Bill Gasson has been at the
Mm-hmm.
table trying to help inform what does this look like? We know we need to have curbs and gutters around how we use AI, but it's here. It's here to stay. It's how our people are being prepared is through the use of different AI technologies, through voice recognition, natural learning processing, all those components and tools that help us actually work smarter and connect with our patients.
Are your people eager, or the nurses that you meet with, are they eager? Are they seeing AI coming to help them, or are they seeing AI coming to replace them?
That is a really good question. I think you're always going to have your early adopters as well as your laggers. I'd say that from nursing's perspective, because I've engaged them from the beginning, let's think about the things that you don't need to be doing. Let's think about those ways that we can make your work more efficient. I think there's probably still a fear and a lot of education that we need to do with our teams, but I think they also very well know, because I've said it over and over again, we're a high touch profession. There's nothing that's going away. We're going to always have to have this connection with our patients. How do we make that easier? And how do we do our due diligence to reduce that friction, not only for our employees, but more importantly for our patients?
Speaking of the high touch component, if you had a magic wand and you think about what AI could take away to help nurses really focus on the patient, what does nursing look like when, the stupid stuff is taken off nurses' plates, they're not checking off checklists all day in the EHR, and they're really spending time with patients?
I love that question, Erin, because I actually was just talking to some other folks about that yesterday in that ambulatory setting. So during that clinic visit, that means that 15 minutes is a personalized conversation that you get to connect with that patient, that you get to truly address what is your goals and how can we connect you to the resources to do that. It's not us having to repeat the same questions and go through these things. It's us making that connection and saying how important their health and wellness is to us. Let me help you make an appointment so that you can get in for your wellness or for your preventative health care. Or, oh, you haven't had your cervical screening? Let's go ahead and get that set up so that we can get that done right here. Let's make it super convenient for you. That's what it looks like in a clinic visit. In an acute care visit, which of course is where my passion is, I'm an ICU nurse by background, spent the majority of my career there. It looks like the opportunity to use our mind and critically assess those patients and actually be able to identify those patterns that might show early deterioration. And those tools are helping me do that. I'm not having to click the boxes because the computer is gathering some of that information. Fall risk, for example, it's pulling some of that prediction from all the risk factors in the chart, and then it's giving me or serving me up some of the most important interventions that I can be spending my time on instead of just checking boxes. It means the ability to connect with patients. It means having really good handoffs and that interdisciplinary team dynamic, knowing how complex that hospital situation is. It means connecting all the dots and making sure that everyone knows that patient's story. And it's not about looking at a computer. It's about really knowing who it is that you're taking care of and using those critical thinking skills and what we, are most passionate about, identifying and caring for them like they want to be treated.
I have to tell you, hearing you talk about it, I would come sign up to be a nurse working for you because, you talked about connecting to the why, and just thinking about coming to a place like you described from the patient lens. That's what I want the nurse to be doing, right? Not just asking me a list of questions and checking them off one after the other, but actually engaging with me. That's what everyone wants for ourselves, for our kids, for our
Right.
parents. And then I can, easily imagine from the perspective of a working nurse how much more engaging and fun it would be to have the data at your fingertips and really be, in the acute care in the ICU setting, to be using your intelligence to make decisions and determinations about the patient, contributing to the diagnostic process, and again, like not be spending your time
Mm-hmm.
checking off boxes. I mean, gosh, that sounds like a better future.
Well, it's what I want, right? And it's what you want. And it's what I most loved about being at the bedside. I just love it. Building those relationships, educating, teaching, learning, right? We learn a ton from the information that we gain. It was one of probably my favorite things about ICU is the impact that we can make by one medication, one little thing, and then putting all the puzzle pieces together. But we have to allow our people time to do that instead of maybe things that don't add as much value. So,
What needs to change operationally or from a training or culture perspective? So as these technologies come in, we start removing these tasks off
mm-hmm,
of
mm-hmm,
nurses' plates. We start shifting them into these things, which again, I think in principle, everyone will say, yes, that's what I want, but it's still change. It's still going to be scary, right? When they say, well, oh my gosh, my job yesterday was spending 3 hours checking all these boxes, and now that work is gone. How do you get people from point A to point B
yeah.
beyond just connecting them to the why?
What I've found is powerful for some, not for all, right? Every audience is a little bit different. And even when it comes to my nursing colleagues, that audience is different because what they value is a little bit different. So meeting them where they're at is really important, but data is powerful.
Mm.
So this is how much time you're spending right now in the nursing navigator. What if we took away these questions? Because in all actuality, they're not really required anymore. This is giving you this much time back so that you can spend time mentoring, maybe a new nurse, preceptoring a student, um, and some of those pieces. The other thing that I have to just be honest with you on is I do spend a ton of time rounding and talking with people, and so action is and being visible is so powerful to our frontline teams. And so most of the time I use my high reliability skills and say, do I have your commitment that we can at least try it? Like, what are we scared of? Have that crucial conversation and say, why can't we just try it? And what could it look like? What's the risk in doing it this way? And be honest with me. If it's not going to work, let's try something different. But doing it the same way and really challenging the norm is um, really what I think people are hungry for too. I think we learned through the pandemic that nurses are scientists, we're natural problem solvers, as are the teams that we partner with. Sometimes we have to um, balance some of the um, tradition of how we need to do things
Mm-hmm.
with what does the patient really need and how do we actually accomplish these goals. Certainly never putting us at risk from a compliance standpoint. That's not what I'm suggesting, but how do we think outside the box and think about how exciting and how much more passion people would have for their work when they can come to work and actually solve those problems and really make a difference, not just for today, but what does it look like for the future?
As you're doing all this, how are you balancing? You said you cover 250,000 square miles
Mhm.
of the US. So as you're automating work and you're shifting the work that nurses are doing, how are you balancing doing that at the local level versus centrally? You know, are you rewriting job descriptions centrally to shift from this is what the work was to the work will look like that tomorrow? Or are you doing that more at the local level, or how are you balancing
Love
that?
that. That's a really good question. If I'm being really honest with you, Aaron, we have a huge project right now related to job architecture, which truly is looking at how are people spending their time, what category do they fit in, and is their job description really talking about what it is that they're doing, or how do we make that more robust? But more importantly, with that job architecture work is what does their career pathway look like? What is it that we have to offer them? Because healthcare is such an amazing, transformative profession. How do we figure out the best way to create experiences for them so that they can understand the world outside of maybe that one unit or that one clinic? How do I balance local versus enterprise work? One of the goals that all of us have is reduction of variation. So,
Mm-hmm.
reduction of variation means that we can get a more reliable outcome. So, as we continue to embark on our high reliability journey, reduction in that variation, standardization of the things that make sense to standardize is incredibly important. And so, I have outstanding operational and clinical teams that I have the opportunity to work with. And we're united in the fact that we're smarter when we work together. We're smarter when we solve problems together, and we can actually execute and sustain the change a whole lot better as well. So part of my job is actually reducing that variation and standardizing where we can.
Yeah, so it sounds like a little bit of like push pull
Yep.
between the local
Mm-hmm.
and the central. And how, I mean, how does policy play into this? Because nursing is a very regulated space.
It
So
is.
as you're trying to innovate, where are you bumping into things that aren't just perceptions of regulatory, but like actual?
Yeah, so phenomenal question. We actually have really close relationships with our board of nursing. So, because we're a border state between South Dakota, North Dakota, Minnesota, Iowa, as well as our other states in our long term care realm, we do need to balance what's that scope of practice, but always putting scope of practice at the center and making sure that we're always being able to address the needs of those patients. And then, how do we partner with our other clinicians and other teammates to do that? I'd say the balancing game that we're at is all of us have a very traditional way of managing in healthcare. And so we actually are using our advocacy team, we're using our legislators, we're using our voice in different ways to try to change that trajectory to a certain extent to make it less difficult for us to be able to access care through virtual care and otherwise, but also then partnering with our payers and trying to innovate and be a catalyst of change in a lot of different ways. But to your point, there is a lot of regulation, not just with our scope of practice and our board of nursing that we constantly respect, but more importantly, what does that other legislation and how do we continue to have a voice at the table as nurses, knowing that we're hands on doing this work? We'd like to help solve some of those problems.
Something I've noticed, being involved in medical education, is the difference in expectations
Mm-hmm.
for what the job should look like in the new generation of physicians versus my generation of physicians or the one that came before me. How is that looking in nursing? As we talk about addressing these workforce challenges, things like virtual nursing, are you seeing a difference in the generation coming through nursing school? Do they have a different sense of what they want from the job, a different sense of what the job should look like?
What a fantastic question, Aaron. I love that. It's actually why I spend a lot of time mentoring new nurses as they're finishing up school, but also as they start their careers because their perspective is so valuable. Um, Two things that we're actually already in process of doing is how do we revamp new employee orientation? We have a lot of internationally trained nurses that are joining our team too, which is magnificent. How do we learn from them and what their needs are? Because there may be some things that we need to learn from that. So we're totally revamping our new employee orientation. More importantly, I think the way that they learn is different. They get very bored with just sitting at a computer and doing computer based training. So, how do we
Mhm.
reimagine what that might look like using micro learnings, using accountability challenges, using our high reliability culture to help us support what does this look like in a different way? The second thing maybe that we're doing to try to help with this is in partnership with our colleges of nursing is how do we look at different curriculum? How do we look at competency-based models? And how do we start to navigate what that looks like, knowing that our board of regents and our boards move quite slowly compared to how fast healthcare is having to change. So we've found that advocacy at the legislative level, but also locally, those relationships with our colleges has been really important to try to translate and do things a little bit differently to meet the mark of our workforce needs.
It's great to get that next generation engaged, and they've got so many amazing ideas. As you look at the next, let's do a time horizon of like 12 to 24 months. What is like the one thing that all nurses would say, "Oh my gosh, Erica is the greatest CNO in the world because she helped remove blank from my workday, and now my job looks so much better." What is like the thing that is driving nurses crazy, that they would like to have off of their plate?
I think documentation is the thing that drives our nurses crazy. So we've been on a pursuit for a while, but how amazing would it be if, just like our docs, we would have technology that we could dictate our assessments, that we could talk
Mhm.
things through? Because when you think about dictating and talking through your assessment, that teaches our new employees, that teaches our other employees, and it teaches our patients about what's happening. It really provides some of that clear communication. So if I were able to get that ambient listening as well as virtual nursing cameras in every single patient room. I don't know that I'm going to get that done in 12 to 24, Aaron, but it would be magnificent because you think about putting all the right technology, but then taking away the stuff that doesn't really matter anymore.
Yeah, no, I could imagine those two making an enormous,
Mm-hmm.
enormous difference. So I'm curious. I'm a nerd. I like to read. I love to find new sources of information. Where do you go to stay current? What are your recommendations in terms of, blogs that I should be reading, podcasts to listen to? Where do you get your information from?
Oh, that's amazing. So, I actually have a couple different sources that I like to look. Advisory board is a really great place that I find some nuggets of information, and then I can find other places to gain insights from that way. I actually, right before I came on this podcast, was preparing an agenda for our nursing evidence based practice and research. So I actually really love to look within our walls because we've got so many
Hmm.
magnificent ideas and projects that are already in process. I don't have to look very far to find some really amazing insights. The third thing that comes to mind, Aaron, is because I've been concentrating on my word of the year. So I'm going to ask you a question. Is this
Yeah.
something that you do? I don't like New Year's resolutions. but I love having a word to anchor on for the year. So my word of the year is nourish. So I've been spending probably the last month at 5 weeks looking at what is my word? What's that word that's going to help resonate with what I'm going to need, how I'm going to leverage, what I'm going to anchor on for this year. So my word is nourish. I'm curious, is this an activity that you do?
I do not have a word of the year. That's a great one. I'm going to have to think about that. I do actually have a template that I use that I've sort of collected over the years of about 10 different questions that I kind of journal on
Yeah,
between Christmas and New Year's. And it's such a great practice to sort of
it is.
reset with intention. My favorite one actually is rearward looking more than forward looking,
I
ironically enough.
see.
I found a question prompt that is basically tell the story of your last year as you know, and the highlights that happened with your family, with your job, sort of through a storytelling lens.
I like
I,
it.
I tried to sit down with my daughter and work through that also, and it was just really fun to think about impactful life events through
Hmm.
that lens of almost like a book
Yeah,
uh, or story, as opposed to the way we usually do it, which is like bullet point
yeah,
accomplishments or like
yeah,
resume
yeah.
style. So I find that one really fun.
I love that. There was a recent challenge that I was doing is start with the end in mind. What is that legacy that you want to leave? So your last question to me was a good one that I'm like, wow, I don't that it's a tough question. What do you want to be known for, right? I think
Yeah,
certainly my passion is something that I'm known for, but more importantly, how are we going to break the traditions that are getting in our way to taking care of the patients that need us? But more importantly, bringing that joy back to the incredible profession that we have. So,
it's so true. Oh,
yeah,
the other one, thinking of forward looking, the
yeah,
one that I
yeah.
love is what are the things you could do to achieve your goals or to achieve 10x of your goals this year. So
Ooh,
basically, we tend to think very linearly
yeah,
in terms of our goals. And sometimes that can lock you into thinking too small or not
yeah.
shooting high enough. So I love the exercise of thinking about like, is there something I can do to unlock 10x of what I was shooting for? And it can just really expand the way you're thinking about the things you take on for the next year.
That is magnificent. I'll have to consider that. That's great.
So final word, any closing thoughts that you want to leave us with?
I think if I were to think about workforce, if I was to think about technology, I think the biggest takeaways that I continuously share with people is fail forward fast. Why wouldn't we give it a try? And are you really liking how you're doing your work today? Right? So,
That
how
last one is so good.
well, if you really stop to think about it, sometimes we just hold on to it because it's
Yeah.
familiar. So this
Yeah.
this notion of change is just really difficult for people. So in some ways, I spend a lot of time helping people navigate change, which means a ton of time. But I'm going to lean in and I'm going to help them. It's okay. That's a really great question. Have we thought about that? Are we really addressing just the edge cases, or are we adjusting 80%? If we can get to 80%, would you feel comfortable with that? Right? So we're a risk averse culture, which is okay. But I think in the space where we're at today, with as fast as everything's moving, our consumers, our customers, our patients, our clients expect us to actually be doing better. And so I think fail forward fast is probably the most important thing that I can share with everyone.
Awesome. Well, thank you so much, Erica. I'll always learn so much from chatting with you and appreciate you coming on.
Absolutely. Take care. Thanks, Aaron.